to another case study through New Education, and we are looking at a older hybrid. I don't know this patient, but I know it's over 5 years old. We have a bit of ailing implants here, some bone loss, failed teeth, disease, gross decay, and a lower arch that needs attending. So here's where we're going to have two discussions, one on the upper and one on the lower. Let's tackle the lower right now. That's pretty straightforward. You don't have a whole lot to actually work with. So let's look at the treatment assessment here. We've got greens across the board on density, facial bone, constriction, and bone characteristics, and i.e. nerve. We start to get into the yellows with the detached gingiva ridge height, but those are still okay, and then the sinus bone, only because we're looking at the upper portion of things. But otherwise, this is a really good case to think about if you're getting into full arch stuff. You've already placed a number of single tooth replacement implants, and this is a really, really good one to find or to come in and allow you to do the work here. So in our office, we're looking always at a detachable system, some sort of locator system, either 4 or 6 implants, depends on the occlusion and what the patient wants to do. We were looking at the first molar area here. We're looking at the canine area, somewhere in that realm, over here, and then we'll be looking at the first molar area here. So that's usually a really good supportive structure frame of mind. Those are always the go-to places that I go to look at, like where's the bone healthiest. So let's look at the CT now. And here you can see that we've got over here in the number 30 area, I'm going to drag that over, a failed tooth, but that doesn't matter too much. It's just root tip, and here's our nerve right down here. So we've got plenty of room, and I know we had put some implants in. Let's see what we have here. Which one is that? That is, no, let's go here. Here we go. So it looks like the doctor had put a 10 by 5 in here. That looks adequate. Your drill sequence will come closer. You're within a couple millimeters. But look at how friendly that is. Oh my gosh, clean that out. You can put the implant in solid. So that should be no problem whatsoever. As we go across, let's look at these teeth here. And you've got so much bone here. You got a lot of supportive structure. It's only if he has a health history of diabetes or some sort of non-healing thing. So here's where the bone becomes a lot softer. You can still do an immediate placement. I don't like it so much because of so much disease in this person's mouth, but you should be able to get them on a regimen. And also you've got a little bone augmentation here that should come down across the board. Here's how high the bone actually is there, and if we put it up here, you know, this is where it's kind of showing us relative to our implant. So, you know, that's not too bad. I don't like things too top heavy, and I don't like things resorbing away, so I would clip away probably that lingual bone or get rid of some of that bone, initial bone height of the crest there. Just to even things out a little bit better as you come along, maybe right here, and get rid of some of the sharp corners. You're going to do a full mouth extraction here, and you're going to be giving this patient a denture. I don't like the all-on-4 model, like I've always said before, and you're going to essentially let them deal with a full lower denture, and then they will understand a little bit better as to what that actually means. And then once you put the implants in, it really kind of makes you a hero. So that, I like that a lot. So here's the next one down. This is number 22. This is, I believe it is a, yeah, that's a 5 by 10 again, and we're still a little bit away from the nerve, so you got to watch that a little bit. Let's see how close we are. We are within a couple millimeters at least. Yeah, so 2 millimeters, so we're okay there. I wouldn't use the end cutting drill. I would go about 8 millimeters in, use a sinus drill to go to the 10 just to make sure we're good. and I would measure that off of the facial bone plate here. I would not go off the lingual. If you do, it could be a little tricky too. So, but give that a go. And let's look at number 19 area here. Let's see, is this 19? Yep. And now I'm centered on 19. So we are still another couple millimeters away. Put a little bit of an angle on it. And that's essentially what it looks like. Let me get rid of some of these measurements. And that is a really, really good all-on-4 locator case for sure for somebody that wants to get out of single tooth replacements, get into a very straightforward full arch case. This is one of the more affordable type treatment plans you could do for a patient. Patients really appreciate it when you look after their finances for sure. And this is going to serve this patient very, very well. He's got a really good balanced occlusion. He's got a good balance. If we go back to this anterior and how his bite comes together, looks like he's almost edge to edge when I look at how balanced that bite is. If we look at it here, he's coming down here with the crowns and the implants right into here, and the supportive nature of his teeth is right in front. This tooth actually looks backwards, or he's missing so much enamel on the front. But you get the idea. This is a really, really, really good case, really straightforward case. Nothing crazy here at all. I love a bite like that. I like that he's spending time here. I'm not crazy about the upper. We're going to talk about the upper in the next segment. So thanks for joining us on this one. Pretty straightforward case study for a full arch case, full arch locator. If you want to do a fixed hybrid, that's fine. If you want to do anything else, this is a great patient to kind of explore those prosthetic ends. So anyway, that's it for this one. Like us on Facebook, subscribe to us on YouTube, and please join us for some comments and everything else going into our live streams. So